Good afternoon, New Brunswick, and welcome to today's COVID-19 update for New Brunswick regarding holiday guidelines. As you can hear in the background, we are just in the middle of roll call for the journalists. I think I will be first in terms of journalist questions, so if you do have any questions and concerns for Dr. Russell or Minister Shephard, who will both be joining us today in today's conference, please feel to write them either by the email under my name, news@chco.tv, or write directly in the Facebook chat, which I am following at the moment. I have a feeling it's going to be a rather full house today. As you can hear, the roll call is still going on. It just happened as we went live on television. But I do have a bunch of questions that have been submitted by the public already, and I do want to get to those once this roll call is done, because I imagine it's a little distracting. There are 691 active cases of COVID-19 currently in the province. 214 of those are in Zone 1, 187 are in Zone 2, 165 are in Zone 3. There's just one in Zone 4, which is amazing, 14 in Zone 5, 8 in Zone 6, and 102 in Zone 7. So as you can see, Bruce is on the line there. He's just wrapping up roll call. There are also other journalists that joined via Microsoft Teams, and I don't know if they're in the same roll call. From the sounds of it, it could be one question, it could be two, but I had some great conversations with viewers this week regarding some of the questions you'd like to ask. One of them was with Gordon just before this conference. He was writing me via email, sharing a great graph of really interesting information about third doses from across Canada. And what Gordon was mentioning, it was something I've been sort of thinking about too, but I'm glad he brought it to my attention, is that New Brunswick and Manitoba are the two provinces right now that are currently not providing I do know they mentioned a certain number of people signing up for booster shots, but the other provinces are sharing booster shot data on their dashboards, which is something that we would like to see New Brunswick start doing. So that is a question I'm considering asking. In relation to that question too, so I think it would be a two-parter, would be at what point is a person no longer considered fully vaccinated, and when will that factor into dashboard material? You know, if there's a certain amount of time and you don't get a booster dose, eventually the efficacy wears off. So at what point would you then be taken off of these numbers? They have to be sort of something that is always changing as time goes on, if booster shots are going to be the reality. So that is a two-part question. I know they don't always love that, but that's sometimes what happens when we only get one question. You try to jam-pack as much information into one single question as you can. So that is one question I'm really considering asking. Kat, I see a question coming in. Oh, it looks like we're about to start the news conference. So I will be seeing you afterwards to join you for a recap. But right now we're going to go right into the conference room in a couple seconds. But again, please feel free to write me your questions and concerns on Facebook if you're following along online, or email, and I will see you afterwards.
Update on COVID-19 in New Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, et le ministre de la Santé, Dorothy Shephard. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Thanks, Bruce. Merci, Bruce. Good afternoon. Bon après-midi à toutes et à tous. Au cours des dernières semaines, j'ai parlé de la façon dont nous devions tous apprendre à vivre avec la COVID-19. Je tiens maintenant à vous expliquer ce que cela signifie exactement. Vivre avec la COVID-19, ça ne veut pas dire ignorer la COVID-19. Over the past several weeks, I have spoken of how we must all learn to live with COVID-19. And I'd like to tell you that living with COVID-19 means I would like to tell you what living with COVID-19 means and doesn't mean. And specifically, living with COVID-19 is not the same as ignoring COVID-19. And it's not about pretending that the virus has gone away. It's not about disregarding public health advice when it doesn't match with your personal plans. Vivre avec la COVID-19, c'est tenir compte du virus dans vos activités quotidiennes. C'est prendre soin de votre famille, de vous et de votre communauté. c'est connaître les risques auxquels vous êtes exposé et agir en conséquence. Living with COVID-19 is about being aware of the virus as you go about your daily life. It's about taking care of yourself, your family, and your community. It's about knowing your risks and acting on them. We have learned a lot over the course of the COVID-19 pandemic. And it's true that some of the hardest lessons have come in the last 4 months during the fourth wave of this global pandemic. We know that the virus isn't going away anytime soon, and it will certainly be with us through the coming winter months. With colder weather and fewer daylight hours, people will be spending more time indoors where the virus can spread more quickly. We know that the overwhelming majority of New Brunswickers are doing the right things, and we want them to continue to do the right things, and they want to continue to do the right things. And we know that many people are frustrated, tired, and discouraged, and I think I heard somebody even say they were tired of the word fatigue. So nobody wants to hear about COVID fatigue because they're tired of COVID, and they're tired of hearing about that as well. And we know that you want to get on with your lives, to work and to play and spend time with loved ones and enjoy this beautiful province that we are so proud to call home. And that's what I want as well. Nous avons un plan pour l'hiver. Et ce plan vise l'équilibre entre la santé mentale et émotionnelle et la santé physique de tous. Notre objectif est de protéger le système de santé tout en perturbant le moins possible votre vie quotidienne. Mais des perturbations ne sont pas exclues cet hiver. We have a plan for the winter ahead. This plan attempts to strike a balance that safeguards our mental and emotional health as well as our physical health. Our goal is to protect our healthcare system while minimizing the disruptions to your daily life. And striking that balance is challenging. Disruptions may happen over the course of the winter. There may be times when enhanced restrictions on gatherings and businesses may be required in specific regions or across the province to arrest the spread of the COVID-19 virus. But if we all actively live with COVID-19 and take common sense precautions, we will be giving ourselves a better chance of limiting the impact of the virus on our province. We want New Brunswickers to gather with friends and family over the holidays, but we want this to be done safely. It's important to be sensitive to your surroundings and sensible in your actions. It's vital that you know and understand your risks. Aujourd'hui, il y a 97 nouveaux cas confirmés de COVID-19 au Nouveau-Brunswick. 75 personnes se sont rétablies, ce qui porte le total de cas actifs à 711. Aujourd'hui, nous déplorons la perte de 2 autres personnes du Nouveau-Brunswick décédées des suites de la COVID-19. Nous offrons nos plus sincères condoléances aux familles endeuillées en ces temps difficiles. Today, there are 97 new cases of COVID-19 in New Brunswick. We have also seen 75 recoveries, which gives us 711 active cases. Sadly, 2 more New Brunswickers have died from the effects of this virus. We mourn with the families of these individuals in their time of grief. If you are not vaccinated, you are at a much greater risk of experiencing the worst effects of COVID-19. People who are vaccinated can catch the virus, but it is the unvaccinated who face the greatest risk of becoming severely ill and requiring hospitalization. We have been experiencing an increase in COVID-19 infections and hospitalizations over the past 2 weeks, and this is very concerning. But when you examine the numbers more closely, it becomes clear who faces the greatest risk from the virus. As the unvaccinated are a much smaller slice of the province's population, they are disproportionately represented in our case numbers. As an apples-to-apples comparison, today's new case numbers translate to 8.8 cases of COVID-19 per 100,000 vaccinated New Brunswickers. For the unvaccinated, the rate per 100,000 is 32.9. That's nearly 4 times that of those who are fully vaccinated. And among the hospitalized cases, 59% are over the age of 60. again, showing that age increases your risk. Le taux d'admission à l'unité des soins intensifs chez les personnes non vaccinées est 10 fois plus élevé que celui chez les personnes vaccinées. The rate of ICU admissions for the unvaccinated is more than 10 times greater than for those who are fully vaccinated. This shows that those who are older and who are unvaccinated are at the greatest risk from this disease. And I'm going to repeat that because, again, we're going into the Christmas season and the holiday season, and I want people to understand who is at the highest risk. People who are older and who are unvaccinated face the greatest risk from COVID-19 right now. But it remains vital that every eligible New Brunswicker become fully vaccinated as soon as possible. I encourage parents to have their younger children vaccinated as soon as possible. Booster doses are now available for New Brunswickers over the age of 60 and those with certain medical conditions. La semaine prochaine, nous étendrons l'admissibilité aux doses de rappel aux personnes de 50 ans et de plus. Puis, dans les semaines à venir, aux personnes de 40 ans et plus, et finalement à tous les Néo-Brunswickois. Lorsque vous devenez admissible à la dose de rappel, veuillez vous empresser de l'obtenir. Si vous n'avez reçu aucune dose du vaccin à ce jour, vous vous exposez au risque de la COVID-19. Next week, we will expand booster eligibility to people in their 50s. In the coming weeks, eligibility will be extended to those in their 40s and then to all other New Brunswickers. When you become eligible for a booster dose, please get one as soon as you can. If you remain unvaccinated, your health is at risk from COVID-19. My advice to unvaccinated New Brunswickers is to avoid gatherings during the weeks ahead. You are at a high risk of becoming seriously ill with this virus. We continue to learn about COVID-19. In the past week, we have seen the emergence of the Omicron variant. Actually, there's two different ways of pronouncing that. I looked it up. There's the American version, which is Omicron, and there's the British version, which is Omicron. While we don't yet know all its properties, Public Health is currently monitoring 80 New Brunswickers who have recently traveled to areas where the new variant is present. We will adjust our strategies to address the impact of this new variant, as we have done in the past. This new variant is a cause for concern, but the public health guidance that has protected us against earlier variants will be effective against this new form as well. Wash your hands regularly and thoroughly. Wear a mask in public spaces and maintain 2 meters of physical distance from others. Know the symptoms of COVID-19 and seek testing when symptoms emerge. This is very important. We do have point-of-care tests available, but the PCR test that's done in our assessment centers is the most reliable. So if you have symptoms of COVID-19, we encourage you to get a PCR test at one of our assessment centers. Please stay home from work or school when you don't feel well. Please get vaccinated and urge the people you love to follow this example. This advice has stood us in good stead throughout this pandemic, and it will continue to do so. We need kindness, as we always have throughout this pandemic, as well as compassion. Nous pouvons vivre avec la COVID-19. Nous pouvons nous protéger contre le virus, tout en continuant à savourer la vie. Pour ce faire, tous les Néo-Brunswickois doivent contribuer à se protéger et à protéger leur communauté. C'est le meilleur cadeau que nous puissions nous faire les uns les autres en cette période de fête. Merci beaucoup. Thank you very much.
Good afternoon. Bonjour. We have been living with this pandemic for almost 22 months, and I know that people are tired and frustrated. But I also know that most New Brunswickers are willing to do what is necessary to protect themselves, their families, and their community. With winter comes colder weather, shorter days, more time spent inside, and increased opportunity for COVID-19 to spread. Government has a role to play in curbing the spread of the virus, but so do individuals. It is important we have a plan in place that ensures our healthcare system is not overwhelmed, but also considers the mental, physical, and financial health of New Brunswickers. Il est important d'avoir un plan qui permet de protéger notre système de santé et qui tient compte de la santé mentale, physique et financière des jeunes de Nouveau-Brunswick. Finding that balance isn't always easy, but it is imperative. A 3-level COVID-19 winter action plan has been created that, when combined with vaccination and public health guidelines, will reduce the spread of the virus. This plan will go into effect on Saturday at 11:59 p.m. and remain in place until spring, at which time it will be re-evaluated. The entire province will be in Level 1 when the plan goes into effect, the lowest of the 3 levels. Level 1 of the action plan is similar to the measures we are currently living under, though there are a few differences designed to help reduce our case numbers and ultimately our hospitalization. La phase 1 du plan d'action est similaire aux mesures qui sont actuellement en place. Mais il y a quelques différences pour aider à réduire le nombre de cas et, au bout du compte, le nombre d'hospitalizations. Rather than tracking your steady 20, informal indoor gatherings in homes are now limited to a maximum of 20 individuals. This is consistent with several other provinces. Informal, private outdoor gatherings are limited to 50 individuals. However, everyone should keep their contacts as low as possible. If you are unvaccinated, it is recommended that you avoid informal indoor gatherings, such as those held in households, because the risk of an unvaccinated individual contracting the virus in these situations is very high. And we just heard Dr. Russell speak to the fact that those who are unvaccinated are at most risk of being hospitalized with COVID. Also, under Level 1, masks are required in outdoor public spaces when physical distancing cannot be maintained. Physical distancing is required in public spaces where proof of vaccination is not required. That means that malls, grocery stores, retail stores, and salons and spas must enforce physical distancing between patrons. Alternatively, they also have the option of requiring proof of full vaccination from all patrons, but we will leave that decision up to individual businesses. These are the main differences at Level 1, but the Winter Action Plan has 2 more levels that include further measures, including reduced household bubbles, lower capacities in public spaces such as retail and restaurants, and no travel into or out of areas at Level 2 or Level 3. At this time, the education system will continue to follow existing plans for schools and for early learning and childcare facilities. Full details on the measures at every level can be found online at gnb.ca. As for how we determine the level, criteria has been identified that would cause public health to look closer at what is occurring in specific areas or zones. These criteria are based on things like the number of active cases, the rate of positive tests, and hospitalizations. I understand this is a lot of information to take in. I encourage everyone to go online to gnb.ca to read the details of the plan. Je comprends que c'est beaucoup d'informations à retenir. J'encourage tout le monde à consulter les sites web du gouvernement provincial pour lire les détails du plan. With new variants of concern, there is a possibility that further restrictions may become necessary. If that is the case, we will adapt, as we have since this pandemic began. I understand people are concerned about what the COVID-19 Winter Action Plan means for their holiday plans. That is why we didn't want to wait any longer to share this with you, so that we can get the new measures in place. Everyone wants to have as normal a Christmas as possible, and we want that for you. Tout le monde veut passer un temps de fête le plus normal possible. Et c'est également ce que nous voulons. Like you, we want to be able to spend time with our family and friends without fear of putting ourselves or our loved ones at risk. The power to keep us in level 1 is in our own hands. While government can come up with requirements and recommendations, it is up to each individual to do the right thing. The measures are not difficult. They are small actions that each person can take that, when combined, can make a big difference. Get vaccinated, wear your mask, continue physical distancing, wash your hands, keep your contacts low. We must work together, follow public health measures, and make good decisions to protect ourselves, our loved ones, and our community. That is how we will be able to make a healthy, safe, and meaningful holiday season. Thank you. Merci.
Thank you, Minister Shephard. Dr. Russell, merci beaucoup, Ministre Shephard et Dr. Russell. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. We'll now proceed with questions from members of the media. Each reporter will have one question and a quick follow-up. You have the right to pose your question in the official language of your choice. Vicky Hogarth, CHCO-TV.
Thank you, Bruce. My question is for Dr. Russell, but possibly Minister Shephard as well. New Brunswick and Manitoba, I think, are the only two provinces that don't seem to be reporting third dose data on the dashboards. Will New Brunswick be including this information soon? And on this note, is there a certain amount of time after a person's second dose, if they don't get a third dose, that they would no longer be considered fully vaccinated, and would that therefore be factored into our vaccination rate?
I'll start, Vicki, and then if Minister Shephard wants to add. About the dashboard, I'll have to get back to you on that one because I thought we were reporting it. But again, if it's not reported now, I can discuss with my staff and colleagues about what it will take to make that happen. For somebody at this point in time to be considered fully vaccinated, it is 2 doses. And with all the nasty recommendations that we've just received, the minimum time that we would recommend getting a booster is 6 months. We do know that that vaccine waning in terms of effectiveness can take place around that time, but it's obviously a range, and it depends on many different things, including what your underlying medical conditions are, what your immune system strength is like, how old you are, what the time frame was between your 2 doses, what that interval was between your 2 doses. So there are many, many factors that come into play. So that 6-month to 8-month recommendation, again, is because there's such a wide variation.
I think Dr. Russell covered it all. I can tell you that we have 53,933 doses that have been administered as of this morning.
Do you have a follow-up, Ms. Hogarth?
Thank you, Bruce. Yes, this is for Dr. Russell. When New Brunswickers who've had mixed doses of Pfizer and Moderna are booking their booster shots, pharmacies are telling them to get the third dose the same as the second dose. So if you had Moderna for the third dose. I'm wondering if you can explain the science behind that and if it's more effective to do it this way. I'm just curious.
So my understanding is that either mRNA vaccine is fine, regardless of what you had as your first 2 doses. So so as of right now, either is fine, but certainly if it is convenient to match with what you've already had, that works as well.
Thank you. Laura Brown, CTV.
Hi there. I'm wondering about enforcement of this plan. Are you going to increase public safety officers, or how will you go about enforcing the gathering limits, I guess?
So We of course have been partnering with public safety since the very first days of COVID, and we will continue to do so. Chances are this will be random. We will concentrate mostly on those who are isolating to ensure that that people who have been directed to isolate are isolating, and the other will certainly be random if checks are necessary. But we, on the whole, I think people will be compliant. They understand what's at stake, and nobody wants to go to more stricter phases. And so we need every single New Brunswicker to be conscious of their actions and how they're gathering. Gatherings is our biggest risk.
Ms. Brown, a follow-up?
I'm also wondering about the status of the 80 people who are in isolation that you're keeping an eye on for the new variant of concern. What was the, do you have kind of a qualification for who you will be looking at, I guess, with more of a focus for that new variant of concern?
So all of our labs are capable of sequencing the new Omicron variant, and so we're very aware and watching for that as our testing goes through. It's not 80 people in our province, I don't think. My latest notes show that it was 40 people in our province who recently traveled from New Brunswick to one of the 10 countries that the federal government has put on a watch list, so to speak. And so these 40 individuals are being followed by the federal government, and then the province has made testing accessible to them.
Pascal Rochnog, Radio-Canada.
Bonjour, ma question est pour la docteure Russell. Est-ce que vous pouvez nous expliquer en français qu'est-ce qui est la différence entre le niveau 1, le niveau 2 et le niveau 3, s'il vous plaît?
Alors, la différence entre les trois niveaux, c'est vraiment l'impact sur les hôpitaux et les soins intensifs au niveau des nombres de cas et la capacité de santé publique pour faire le traçage de contacts étroits, etc. Mais au sujet de c'est quoi sont les mesures, niveau 1, c'est quoi ce qu'on est maintenant. C'est vraiment, et je veux dire, toute cette information, tu peux le trouver sur le site web. Je ne sais pas si c'est là dès que maintenant, mais certainement après la conférence de presse, tous les détails vont être là. Alors, je ne sais pas si tu veux que je lis toutes les parce que c'est un gros tableau, mais c'est vraiment... C'est très détaillé, mais au niveau qu'on est maintenant, c'est proche de quoi ce qu'on était en train de faire avec une couple de mesures en plus pour essayer de baisser les nombres de cas qu'on voit maintenant. Avec le niveau 2 et le niveau 3, c'est plus des mesures qui sont un peu plus strictes. Vraiment avec le but de diminuer le nombre de cas et les nombres de gens qui sont hospitalisés, les nombres de personnes qui sont admis aux soins intensifs.
Et comment vous allez déterminer si on doit rester au niveau 1 ou passer au niveau 2? Est-ce qu'il y a des déclencheurs ou est-ce que ça va être un peu au cas par cas?
Alors, on veut pas les appeler des déclencheurs. Ça va être des critères pour faire un assessment, pour guider nos discussions. Alors, pour aller de niveau 1 à niveau 2, ça veut dire qu'on verra le taux, le moyen de 7 jours de nouveaux cas, ça augmenterait. Le taux de positivité, ça serait 10% tout alentour du province ou dans une seule zone. Ça serait 70 cas hospitalisés tout alentour du province ou 30 cas actifs dans les soins intensifs. Les ressources de santé publique, ça serait pas capables de faire le traçage de contact étroit ou les endroits d'exposition dans un temps qui est raisonnable. Alors, pour aller retourner au niveau 1, ça serait une évaluation avec l'information, les détails sur le moyen durant les 7 jours, ça diminuerait. Et aussi, on verra aussi le moyen de 7 jours des cas qui sont hospitalisés, on verra ça diminuer aussi. Pour aller du niveau 2 au niveau 3, ça veut dire que le moyen, encore, ce serait pour la discussion, pas pour la décision. On verra le moyen de 7 jours, de moyen de nombre de cas de 7 jours, ça augmenterait. Le taux de positivité, ça serait 15%, soit pour toute la province ou une seule zone. Il y aura 100 cas actifs hospitalisés dans la province ou 50 cas actifs dans les soins intensifs. On verra le nombre d'admissions à l'hôpital augmenter. On verra aussi les ressources, des problèmes avec les ressources de santé publique pour le traçage de contact. Alors, c'est ça. Ça, c'est tous les critères pour une évaluation et ça va tout être sur notre site Web.
M. Rachnog, un suivi assez rapide.
Oui, juste une question sur les frontières. Est-ce que vous avez l'intention d'imposer des contrôles aux frontières ou d'empêcher dans une des phases, la 1, la 2 ou la 3, est-ce que ça va limiter les déplacements pour sortir ou entrer du Nouveau-Brunswick?
Au niveau de le voyage à travers de nos frontières, c'est vraiment le fait qu'il faut que vous soyez inscrit pour entrer dans la province et dépendant d'où vous venez, puis si vous n'êtes pas vacciné, il va falloir que il y a des endroits où il va falloir que vous preniez des tests, mais aussi si vous n'êtes pas vacciné, il faut que vous isolez pendant 14 jours et sur la 10e journée, prendre un test de COVID. Et toutes les gens qui vont voyager ici au Brunswick par avion, ils vont être donnés un test rapide. Et aussi, les voyageurs internationaux, ça c'est sous la loi du gouvernement fédéral. Ils ont besoin de se faire tester et isoler. Et ils vont falloir un test sur la 5e journée et la 10e journée après qu'ils sont ici au Brunswick. Et pour le niveau 2 et le niveau 3, c'est vraiment, il n'y a pas de voyage entre les endroits qui sont impliqués. Sauf que des raisons essentielles.
Merci, M. Rachnog. Merci, Doctor. We'll now go to Nathan DeLong with the Miramichi Leader.
You folks can hear me okay?
Yes, thank you.
Okay. My question is for the minister or Dr. Russell, whichever of you can answer. You've spoken a lot in recent weeks about your concerns about the case counts in Zone 7, and I understand that earlier this week the Miramichi region was flagged as being one of the highest in Canada in per capita case counts. So I'm just curious as to what the province intends to do in hopes of reducing case counts in Zone 7, given that information.
Well, I'll start, and Dr. Russell needs to jump in. She absolutely knows that she can. So that's what this winter plan is all about. I was very direct in asking questions to our team. Do you believe that these measures will bring our numbers down? And the answer responded to me was yes. And public health does a tremendous job in helping us to understand the important issues that we need to consider when we're making policy. And that is the mental and physical and financial well-being of all of our citizens. COVID-19 is not going away. It is going to be a part of our life for a while, and we're not sure how long that while will be. So it is really important that we get our communities, we get our people, everyone to join in to social distance, wear masks, wash your hands, limit your gatherings. It's the less people that you're interacting with on a regular basis is one of your very, very best protections. And I'm fully, I want to be fully confident that I think the people of New Brunswick are going to do what we need to do. They're going to follow the rules. And if we follow the rules, we're not going to have to get them to be more strict.
Mr. DeLong, do you have a follow-up?
Yes, I do, Minister Shephard. I believe you recently stated that you didn't believe that increased restrictions would do the trick given the lack of success of the recent circuit breaker measures. But doesn't this seem like you're also announcing more restrictions? What would you say to people who I guess are perceiving that you're sending messages in this situation?
Well, we try to be as genuine as possible with our responses. At least I do, and I know Dr. Russell does. And rising numbers are concerning. It doesn't matter if most people will not get seriously ill if they're vaccinated or hospitalized or ICU admitted. But we want our cases to go down. We want people to feel like they are in a safe community. And so, we've also seen though that the circuit breaker certainly wasn't having a great effect in Zone 1. So what we are hoping is that we have proposed something here that everyone can live with and abide by because of that. And by doing this and by following public health measures, together we can make this happen and we can live a fairly normal life.
Thank you, Mr. DeLong. Thank you, Minister.
Thank you.
Bobby Jean McKinnon, CBC.
Hi.
Bobby Jean?
Hi, it's Marie from CBC. Bobby Jean's just been called away, so I'm just going to ask for a question for her. First of all, can I get some clarity on whether it's 80 or 40 travelers that are isolating from the Omicron-barred countries? We've heard two different numbers here.
Minister Shephard will provide the update, and we'll just bump you up to Bobby Jean's spot, okay? Go ahead, Minister.
Thank you, and I appreciate being asked that. We just got an updated, I just got an updated message here that says the actual number of people we are now monitoring is 55 individuals who traveled recently from one of the 10 countries.
So to your question, Ms. Sutherland now?
Yes, thank you. So where in the province are these 55 travelers located, and are they isolating in hotels or homes?
They are isolating at homes, and they are all over the province. They are being monitored, and we're working with our federal partners, and the province is ensuring that they have access to testing.
Ms. Sutherland, do you have a follow-up today?
Yes. Am I going to also be able to ask my own questions, Bruce, or you said I was bumped up to Bobby Jean's place?
You've been bopped up to Bobby Jean's spot. So your follow-up?
Okay, so Minister Shephard, you said the plan will remain in place until spring. Do you have a specific date in mind, and is there a chance you'll revisit that if cases drop dramatically or not?
Not that I'm aware of.
Thank you. Savannah Odd, Telegraph Journal.
Hi there, can you hear me all right?
Yes.
Okay, great. My first question is, I'm wondering, Dr. Russell, if you can speak to why we're starting at level 1 when we have so many people in hospital. I guess why not start with the stricter measures so that maybe we can ease those up a bit more towards the holidays?
Yeah, that's a great question. I think we're struggling with the numbers in terms of, what our baseline capacity is with respect to, how many active cases can we have at a time, knowing that there's a certain proportion of those that will require hospitalization and ICU admission. You're correct. We haven't really seen that baseline number of active cases go down as much as we'd like, and so we're continuing to see admissions to hospital. But by bolstering level 1, in terms of adding extra measures, then again, those are the things that we're hoping will get those numbers down. We don't really want to go to level 2 or level 3 unless absolutely necessary, and we've laid out what the criteria would be for assessing that situation if it were to arise. Are we close to that right now? I mean, we're closer than we're comfortable being to it in terms of, we really are hoping that these new measures for level 1, in addition to what was already taking place, obviously wasn't successful, and neither were the circuit breakers. So I think having a level of heightened awareness and heightened vigilance for the entire province in all zones will be extraordinarily helpful if everybody follows the measures and takes this to heart. We know that, again, the same things that worked before will work now if everybody takes them seriously. And I think we've laid out very clearly and very specifically how to do that. And it's a matter now of the public adopting that and reintegrating it into their lives. Again, we've been through these types of changes before. The public is knowledgeable in terms of what can be done and should be done. We're just trying to be very explicit at this moment in time and again, be transparent about what the risks are right now, and if things change, what will need to be done in terms of other measures to address them.
If I could just build on what Dr. Russell has said, aside from the community transmission that we know has happened, the distancing in businesses should help with that. Making sure that people are really conscious of what they're doing when they're out. I know that not everyone can go to the grocery store without their children or spouse. And what we're saying is to try to start limiting the number of people you're around. And that can go a long way, and it's a really, sometimes it's a very easy thing to do, and we know it can't happen all the time, but it's a little thing that can make a big difference. And so if people can focus on the little things that they can do to prevent the spread and the contraction of COVID, we know that household gatherings and the workplace are two of our biggest exposure sites. So keep your contacts low. If you're sick, please don't go to work. And take those extra precautions, get tested, and follow public health measures. All of those little things will go a long, long way to helping bring our numbers down.
Ms. Odd, follow up?
Yeah, thanks, Bruce. So some of the criteria you mentioned for moving up to stricter levels involve hospitalization counts that, if I'm not mistaken, we've never seen before. I think our hospitalization record number is 68, but public health has landed at those thresholds of 70, 100 in hospital, like 70 and then 100 for the second level jump. So my question is, are we expecting 100 hospitalizations to be in the realm of possibility after the holidays? Is that expected by public health?
Well, we are preparing for different scenarios, including those numbers going up. We obviously don't want that to happen, but if it does, these are the things that we will be using to evaluate the situation moving forward. Having high numbers of hospitalizations and ICU admissions for COVID-19 patients means that resources have to be funneled from other areas of the hospital. Other services have to be suspended or delayed or postponed. Again, at the height of some of the ICU admissions and hospitalizations, patients have had to be transferred. These are all situations that we want to avoid, and we can avoid if we get the number of active cases down to a certain level whereby that that proportion requiring hospitalization and ICU admission decreases. We do need the population to understand that vaccination is the number one way to avoid that. Number two is to limit our gatherings and our close contacts where we're indoors not wearing masks. And so all other situations, if you can be outdoors, great. Wearing a mask, great. And again, if you are in an indoor situation where you're not with your close contacts, again, keeping your mask on at all times is really important to prevent spread.
Thank you both. We're going to go to Travis Fortnum with Global TV.
Hi. Last Christmas, we also had gathering restrictions indoors of 20 people, and in the days leading up to the 25th, we kept hearing about concern of a post-holiday spike, which we obviously ended up seeing. Is there the same concern this year?
Absolutely concerned about that. And obviously with this new variant of concern, it's even more challenging in terms of what the scenarios could look like. And so that's why, what today is, December the 3rd. So December the 3rd, that gives us several weeks to really clamp down in terms of our personal choices and decisions around managing these risks right now as individuals to protect our community and to protect our hospital system.
Mr. Fortnum, do you have a follow-up?
Yep. Sorry, I didn't want to interrupt you. Thank you so much for that answer. My second question is for Minister Shephard. Minister Shephard, you said that you had faith New Brunswickers would do what it takes to stick to these new rules. But lately, we've been hearing a lot of concern about rules being shirked. So I'm wondering what makes you confident that we are going to stick to these rules? Not we as in me, we as in New Brunswickers as a whole.
For me, it's about we know that that there isn't anyone that's not tired of COVID, but I do feel that somehow people thought things were going to be worse than they are, and that the restrictions may be unattainable. I think we're showing that these restrictions are not only manageable and doable, but they're livable. So if we can just convey the message that all of these little things add up to great big benefits for us, I feel that the majority of people sincerely want to do the right thing, and I do feel they will.
Thank you. Allison Sampson
Thank you.
with CTV.
Good afternoon. My question is for Minister Shephard. 14 mental health walk-in clinics are supposed to be introduced, I believe, by the end of this month. Is there a progress report on how those are going?
Actually, all 14 are open by the end of October.
Do you have a follow-up, Ms. Sampson?
Yes. So where have they been established?
They've been established at the public health clinics throughout the province. That's why we went with 14.
Simon Delattre, l'Acadie Nouvelle.
Oui, j'avais juste une demande de précision par rapport à la question de Pascal Rechenoy tout à l'heure. C'était au sujet des frontières. Est-ce qu'il est question de contrôle frontalier, de contrôle terrestre, je veux dire, aux frontières physiques de la province? Parce que vous avez simplement mentionné de contrôle aux aéroports, si j'ai bien compris.
So I can tell you that we won't be having border controls at the borders. But what we will be doing, travel registration is still mandatory. And those who come into the province who are unvaccinated must isolate and get a day 10 test. And then at the airports, we will be providing point of care test kits to all travelers who come into New Brunswick by air and asking them to self-monitor and self-test.
Monsieur Delattre, as-tu un suivi cet après-midi?
Non, merci beaucoup.
Merci, Monsieur Delattre. We'll now go to Erica Butler with CHMA in Sackville.
Hi there, can you hear me?
Yes, a little louder to your microphone. Thank you, Erica.
Okay. A question is for Dr. Russell. Dr. Russell, in Zone 1, the majority of cases, as they're announced, come in as under investigation, and there are still thousands or over 1,000 cases listed as under investigation on the province's COVID-19 dashboard. At the same time, we've heard that cases are predominantly coming from transmission within households, which one would expect to be showing up as having a known case origin. So I guess I'm wondering if you can explain a bit about what accounts for that discrepancy, that it appears that there's large numbers of people in Zone 1 who are catching COVID out and about in the world and not within their household, yet we hear that household transmission is predominant. Can you explain what's going on there?
Well, the introduction of a case of COVID into the household means that whoever's living in that household, it will be transmitted to. So in terms of the transmission patterns, you are correct that the transmission is happening in a household. How it gets into the household, there are many different sources. Sometimes it does take a while to find them. Sometimes we don't find them. And so, yes, there is community transmission in many situations right now, which is concerning. And again, we've tried to lay out this winter plan to try to address some of the risks that we know are coming from those types of situations.
Ms. Butler, do you have a follow-up today?
Yeah, I guess just further to that, so when we see the majority of cases in Zone 1, say, coming in as under investigation, would that indicate to you that that's not a household case? And so I guess where are those mainly coming from? If these cases that are under investigation, we don't know the contacts, there's no contacts obvious. Where are those cases coming from?
Well, that's the definition of community transmission, is that we don't have a known source in terms of the origin. Once it gets into a household, again, we're seeing a lot of transmission inside households, but if once it's introduced, but the nature of community transmission means that we actually don't know the source. We don't know where that person contracted COVID-19, came into contact or was exposed to it outside of their household. So that's, again, that's the definition of community transmission, that we don't know the source.
Thank you, Ms. Butler. We're now going to proceed with Adam Heuris with Brunswick News.
Thanks, Bruce. Question on boosters. Minister Shephard, earlier this week you said public health clinic staffing may determine how soon the booster list expands into Brunswick. Dr. Russell said earlier that the list expands to 50 plus beginning next week. So just like an update on the capacity issue to deliver these shots.
Well, we wouldn't open up to 50 plus if we didn't think we had the capacity to do it.
Mr. Heuris, do you have a follow-up?
Yeah. NACI said today that boosters may be offered to adults age 18 to 49, at least 6 months after their second dose. I believe those age groups are hitting 6 months now in New Brunswick. Dr. Russell said earlier younger groups will follow, but can you give a clear timeline on when that will happen?
I'm kind of learning my lesson about timelines, Adam, but I can tell you it'll be in the coming weeks.
Thank you, Mr. Heuris. Thank you, Minister. David Coach with Brunswick News.
Hello. My question is about the House of Nazareth homeless shelter in downtown Moncton. Obviously, winter has arrived. COVID-19 is now in the homeless community. There's been both Moncton's downtown Moncton's emergency shelters, dozens of cases. One homeless man has died after catching COVID-19, although no deaths have been officially linked to the shelter outbreaks. And the other downtown shelter, Harvest House, is consistently full and has requested funding from the province for 16 more beds. Do you believe the provincial government is doing enough to curb the spread of COVID-19 among homeless people, staff, and volunteers in shelters? And that's for either the minister or the doctor.
I'll start. We're certainly supportive of our shelters throughout this province, and I know that Minister Fitch has certainly been continuing with funding and increasing funding where they have where they've deemed necessary. And I certainly know that we have extended the Janssen vaccine to our shelters and shelter community and to our vulnerable communities of transient population and of our vulnerable population. Because if we can get one dose in their arms, we'll take it. And so we're doing everything we can to try to bolster that that group.
And I can just add that the next swabbing for Nazareth House is on December 6th. Vulnerable populations have been a huge priority for public health with respect to COVID response throughout the pandemic. And very early on, we had working groups that were dedicated just to COVID response and COVID response for those groups. At this point in time, again, we have our prompt teams that have been able to help with many situations involving shelters, et cetera. It is a challenging time. This is a challenging situation. When we talk about vulnerabilities, I mean, it's vulnerable. People can be vulnerable because of age. People can be vulnerable because of underlying medical conditions. They can be vulnerable because of the insecure housing situation and vulnerable because they're not vaccinated. Insecure housing can mean that they are either living on the street or sometimes living in a shelter or sometimes living on somebody's couch. These are really difficult situations in terms of the risks of COVID and trying to manage isolation requirements, even treatment. For some people who require treatment in these vulnerable settings, again, we have been doing everything that we can possibly do at this time from a public health perspective in trying to manage this. There are continued risks, and again, they will continue to be challenging to address, but we definitely have put a lot of effort and time and thought into all vulnerable populations, including people who are insecurely housed.
That concludes today's COVID-19 update for New Brunswick with Dr. Russell and Minister Shephard. Obviously, guidelines today for winter coming out. I will post those to our Facebook page, so CHCO.TV on Facebook. Once I have them from the province, I just refreshed my email. I don't have them yet. But just for Cole's notes of what they are, it's a limit to informal gatherings of 20 people if you are having an indoor gathering over the holidays, and this will extend beyond that into winter. Now that will be phase 1, what they're calling it. It's kind of like how we've had different color levels at this point. It's like a level 1 now and that's where we're starting from. And if things do increase in a health zone in terms of the number of active cases, that could move to what I understand is a level 2. This will all be explained in the information I will have later and we'll be able to post. Based on the conference, these restrictions could become more strict if we do have an uptick in case counts, and that could be something that happens after the holidays. Informal outdoor gatherings, that's a limit to 50 people. Obviously, if it's a nice day like today, that's still a possibility. But again, we're looking at 97 new cases of COVID-19 in the province today, and this week was a really high daily case count week. So the reality of things moving in a different direction, that could be just a matter of a lot of rule breaking over the holiday season. We will see what happens. If you remember last January, now this was prior to the vaccine, last January was when New Brunswick had really what I suppose would be our second wave. Was our second or third? I can't remember now. It's all a blur. But again, after the holidays last year, there was a lot that went on in terms of them realizing the ramifications of not having stricter guidelines in place last year. But again, there weren't vaccines at play. But again, then there weren't variants, and now there are. So it's a whole new bag for them to deal with. So I will post those online. There were 2 new deaths today as well. I don't have the age of those 2 new deaths or the health zones yet, but as soon as I have those, I will update them as well. So look for those winter guidelines on our Facebook page. Thanks for joining me today. I really appreciated being able to ask 2 questions that came in this week from viewers at home, and not just from 2 viewers. Many people call in with similar questions, but I'd like to give a special shout out to Bonnie and Gordon, who were 2 of the people that I had really long conversations with about those questions, and I really appreciate the feedback from the community. So really, please feel free to reach out at Vicky, VICKI.Hogarth, HOGARTH @CHCO.TV if you have any questions or concerns that you'd like us to bring to these conferences. It's always a privilege and a pleasure to do so, and I like that our role is being your voice in these conferences. So I will join you next time, but I will look for your feedback before then. I'm Vicki Hogarth at the CHCO News Desk. I'll see you next time.
A news and public affairs production of CHCO-TV, New Brunswick's only source for independent community television.